In our first video, we introduced the concept of One Health and AMR, Antimicrobial Resistance. And what we mean in that is really talking about antibiotic resistance, where the bugs become resistant to the antibiotics we've been using for decades in animals and humans. In this video, we're going to look at how that affects human health and animal health.
Antibiotic resistance is about bacteria changing to get used to the fact that we're now in a world where there's lots of antibiotics used in human healthcare and lots of antibiotics used in animal healthcare. And the bacteria change so that the antibiotics don't kill them as easily as they used to kill them in the past. That's the science end of it, and the practical end of it is what that does for people. What it does for people is it means that people who have ordinary infections like cystitis, we need to use antibiotics that are sometimes harder to use than we used to have to use in the past. For example, sometimes we have to give people IV antibiotics, whereas a tablet used to work in the past. And that's how antibiotic resistance affects people. But perhaps the group we're most worried about in relation to antibiotic resistance is people who have very serious illnesses like cancer or who have major surgery. And the treatments that they need to get through their cancer, those treatments, they kill the cancer, but they also do a lot of damage to the body. And during that period when the body is recovering from the cancer and recovering from the treatment, ordinary bugs that normally stay in the gut and do more good than harm when they stay in the gut start to come out and get into the bloodstream, and they start to get into the kidney, they get into the lung, and they cause very serious infection. And our choices of antibiotics to treat those kind of really serious infections are much more limited than they were in the past. And we sometimes find ourselves using combinations of antibiotics, and sometimes antibiotics that have more side effects than the antibiotics we used to use. And the reason we do that is because the antibiotics that I could have depended on to treat those patients 15 years ago, I can't depend on them now because the bacteria have changed and have become more antibiotic resistant. And one of the things that makes all of this so worrying is that there are so few new antibiotics available. So we used to think that there'd always be another new antibiotic to fix the problem of the resistance that had happened, but that's less and less true, and so our choices have become much more difficult. And there's no doubt now that there are people who should have survived their cancer if we had antibiotics to manage their infection, who are not going to make it and who don't make it because the antibiotic resistant bacteria that causes the infection during their illness is one that we can't manage anything like as well as we could manage it 10-15 years ago.
Every farmer knows a situation where they've used antibiotics to treat a pneumonia case, to treat lameness, to treat mastitis. They know the important role of antibiotics in the farm. What happens with antibiotic resistance is if you repeatedly use these antibiotics in infections in your farms, the potential for the bugs that cause the infections to become resistant increases. And that's what antibiotic resistance is on our farms, where we depend on these antibiotics to treat really important infections. They stop working. And that is something we should be really worried about as farmers.
So thanks to what you've heard from both Martin and Tommy, we hope you now have a better understanding of what AMR is. That when we talk about AMR, we essentially mean antibiotic resistance, whereby the antibiotics do not work to treat the bacteria. Bacteria have been around for millions of years, and they will be around for millions of years to come. They are so smart, they know how to adapt, and they know how to adapt to the medicines that we depend on to treat them. So it is so important that we all work together on this One Health issue to protect these antibiotics so they work for ourselves and our families when we go to treat our animals, that they are also effective, and that we also work to protect our environment in which we all live.